We all know that prevention is better than cure. There are two main diseases that are conquering the world, that is the diabetes and hypertension. Majority of the people with diabetes and hypertension, they develop complications throughout their life and it becomes difficult to manage them. So how do we prevent these two diseases from conquering our bodies and the world? All right. So we have two or three or four types of prevention, but to for this lecture or video, we have only one that is necessary for to focus on, and that is the primary prevention. This primary prevention can be done through reducing the weight, improving the diet, and regular exercise. Among the exercise that's advisable for everyday routine is greater than or equal to 30 minutes, and that's 5 days per week. You can take 2 days off. The different exercises that we can do usually, this is not a complete list, so walking, jogging, running, or cycling. So among these, the usual ones, the cycling is known to be more effective in preventing diabetes, and reason why that is that when we cycle, what will happen is the muscular soleus, that is the muscle on the leg on this side, that will help us increase the metabolic rate and also improve the uh, glycemic control. That's how it does. This muscle is known as exclusively increasing for the medical. Um, in recent medical research, it has been shown to be more effective in increasing the basal metabolic rate. What about the prevention? We can prevent the percentage of prevention we can do. We can prevent the diabetes and its complications and also hypertension by improving the lifestyle modification, by doing exercise, reducing the weight, and also improving the diet in 95% of cases. And why I say 95% cases, in some individuals there is some predilection for diabetes to happen, nevertheless, with or without exercise, regardless of exercise or without exercise. And those are the HLA genes that they are associated with that. If they have some HLA genes that makes them prone, then they have increased risk of diabetes. So that's about it. The primary prevention is reducing the incidence of the disease altogether so that we don't have complications. Every individual in the world has the population in the world population, almost 1 in 5, 1 in 7 individuals have either diabetes or hypertension. Among the demographics, the Asian population is more prone to diabetes than the Caucasian population. Why? Because Caucasian population is has more protein on their plate than the carbohydrates. And so this is the plate of a Caucasian, which has got more protein in it and less of the carbs. whereas the Caucasian Asian population, it has got more of a carbohydrate meal. Everything's carbohydrate, from breakfast to more of carbohydrates in the meal. That's how are at greater risk of having diabetes than the Caucasian population. That's one of the thing. And Asians have around 15 to 45% of fat in the body compared to the Caucasian population, who has 8 to 15% of fat. That's how different the demographics are. And we can think of the rarity of the um, crops over there in the Caucasus and the other northern countries, because Asian land is fertile land. You sow anything that you can grow anything on the fertile land. India, China have make the most population of the world, and one of the reasons for that is the fertile lands. The fertile lands throughout the year, they can grow crops, they can grow anything they want through the soil, from the soil, and consume it and export it. But the northern areas and the other places, they are not like that. That's one of the thing. So that was about prevention. Now coming to other types of prevention, there is the secondary prevention, that we use it for screening, and we screening the individuals. For example, the blood glucose um, test, finger prick test, and others. What about the tertiary prevention? This is when the disease has already occurred, and we treat it with chemotherapy in the case of cancer, or maintaining the blood sugar levels or the blood pressures. And quaternary is by sharing the medical records to avoid the repeat diagnostic tests and other invasive interventions. The other invasive interventions, if it happen through the doctor, they are known as iatrogenic injuries. All humans are prone to mistakes, and that is one of the reason why we share the medical records of the patients. Thank you for watching. My name is Dr.